Hi, my name is Mileida. I am the respiratory care student at Miami-Dade Community College, and I'm here to demonstrate how doing the trachea care. First, to doing the trachea care, I have to check the doctor indication and see if any indication to doing the trachea care for my patient. After I see if my patient needs to doing the trachea care, the indication to doing the trachea care is to clean the inner cannula, because the inner cannula is get flooding with mucus and secretion, and that can impair my patient to breathe well, and he can get without oxygen. Also, he can get any infection inside the airway. And the hazard of complication is when we're doing the trachea care for the patient, we need to be careful because we are moving the tube inside the trachea a lot, and that stimulates the coughing and the stomach can coming out. If the stomach coming out, it's going to be bad because we have to intubate the patient or we have to introduce the tracheostomy again. Now I'm going to knock the door, go inside the room. I have to introduce myself to the patient. I am Mileida. I am the respiratory here today. I'm here to doing your trachea care because your inner cannula is flowing with mucus and you can get infection, and that impair you to breathe well. I'm going to wash my hands but for 15 seconds, but for purpose of education I'm going to use the antibacterial gel. I'm going to scrub well, and I'm going to put my gloves on. Also, I have to apply the appropriate PPE in case my patient has any isolation precaution, and also if he doesn't have any isolation precaution, I can use the isolation gown to protect myself for the secretion. After I put my gloves on, I have to identify my patient. If my patient is the correct patient, I have to do in the care. I need to ask for his name and the birth or his date of birth, and after I see if the correct patient, I'm going to do the respiratory assessment. The respiratory assessment, I have to check the heart rate, respiratory rate, the oximeter, and listen for sound. I'm going to get the other side. It's more comfortable for me to work. Also, I have the trachea care kit over here to do the trachea care. Take the breath. Take the breath. Take the breath. Take the breath. My patient sounds clear. He doesn't have no mucus and secretion inside his lungs. I don't need to do no suction. How I know I don't need to do no suction, I'm going to start doing the trachea care. I'm going to put the table close to me and the patient to have enough room to access all the equipment. I need to have the trachea care kit, the stomach tie, and sterile water. I'm going to put the bed in sit position. My table is sterile already and clean. I'm going to open the trachea kit. The first clean sterile sheet I'm going to put over my patient to protect he not get dirty, his clothes not get dirty. The second one I'm going to open in the table to pour all the trachea care. Everything has to be sterile. I'm going to put water, sterile water, in the free of the compartment. And I'm going to put in one of the compartments peroxide And I'm going to put my sterile glove. I have to doing the appropriate technique to put my sterile glove. After I put my sterile glove, I'm going to separate the gauze I'm going to use, the one I already cut, to put around the flange on the skin. I'm going to remove the inner cannula. I'm going to put in the compartment hot water, sterile water and peroxide. I'm going to clean inside with a brush to remove all secretions and mucus. Outside, I'm going to drop in one of the sterile water compartment, in the second sterile water compartment, and after, I'm going to put in one of the sterile gauze to get time to dry with the air. Now I'm going to remove the dirty gauze around the flange of and the skin, and I'm going to use the Q-tip. I'm going to get wet with water, and I'm going to clean around the stomach and the flange to remove any secretion and mucus. I'm going to get one of the gauze. I'm going to wet with water, and I'm going to clean around the stomach, the phalanx, and the skin to remove all secretion. And also, I have to check the skin, and if the skin is irritated or has any redness, I have to notify that when I'm going to char it, and see if it's any smell. Everything is okay. Then I'm going to dry very well, because if you get wet, the skin can break down and get infection. After you dry the skin, you get the inner cannula and try to dry outside and inside with the little brush. And put it back. You have to put it back 9, 6, and clip. Now I'm going to change the type for a new type. I'm going to gently put my patient with the O and put the tie around his neck. When I'm changing the tie, I have to hold the phalange and the stomach well to not coming out my patient. I remove the first part. I have to be careful. The stomach not coming out. After I put the new tie around his neck, I have to check I put 2 fingers between my thigh and the neck to see if enough room and it's not too tight or it's not too loose. And I'm going to put the new gauze around the correct one. It's going here to protect the phalange and the skin. After I done, I have to throw away everything I use in the hazardous bag. I have to check doing the respiratory assessment again. I have to see the oxygen of my patient. I need to check for heart rate, respiratory rate, blood pressure, and chest auscultation. Take a deep breath, take a deep breath, take a deep breath, take a deep breath. I hear my patient sound okay, he's stable. I'm going to tell somebody's coming to check on him later on. I'm going to remove my gloves, wash my hands, and go outside to charge everything I was doing today. Thank you so much. This is the way we're doing trachea care for the patient.